A subtle moment takes place in the body after 60, and most individuals never perceive it. The same medication you've consumed for years, the one your body tolerated without any issue, can suddenly start to act differently. Not because the medicine changed, but because your body did. And in some instances, that difference is not minor. It can mean the contrast between protection and peril, between stability and a gradual progression towards something far more serious, such as a heart attack or stroke. What renders this especially hazardous is that nothing feels wrong at first. No distinct warning sign, no pain, no clear signal, just a silent alteration. And today, we're going to discuss 5 specific types of medicines that after the age of 60 have been connected to an elevated risk of cardiovascular incidents, especially when certain conditions are present or when they're utilized the same way they were years earlier. But here's the part that is most crucial. This is not about apprehension. This is about comprehending what's actually happening inside your body, so you can make more informed decisions moving forward. My name is Dr. William. I'm a medical doctor and physician, and on this platform, I break down complex health topics into clear, practical explanations so you can better grasp what may be happening inside your body and what actually makes a difference over time. If you find this type of information beneficial, you can subscribe, but more importantly, stay with me through this because one of the medicines we'll discuss today is consumed daily by millions of people and almost never questioned. Now, to grasp why these risks increase after 60, you have to begin with something most individuals are never told. Your body does not process medicines the same way it used to. And this is where things start to change. As we age, several systems in the body begin to slow down. The liver, which is responsible for metabolizing many medicines, becomes less efficient. The kidneys, which filter waste and excess compounds from the blood, also lose some of their filtering capacity. That means drugs remain in your system longer, sometimes significantly longer than expected. And when that happens, even a normal dose can start to function like a higher dose over time. But that's only a portion of the story. There is also a change in how your blood vessels react. Your arteries become less pliable. The inner surface of your blood vessels becomes more sensitive. Circulation patterns change, and the balance between clotting and bleeding becomes more fragile. So, when a medicine interacts with any of these systems, the effect can be intensified. And this is where individuals get misled. Because the medicine itself is not necessarily dangerous, it may have been completely appropriate when it was first prescribed. It may still be valuable today, but the context has shifted. And medicine, more than most individuals realize, is all about context. The same medication can be helpful in one situation and risky in another. The same dosage can be appropriate at 50 and overmuch at 70. And yet, in real life, prescriptions are often continued for years without being thoroughly reevaluated in detail. Not because doctors don't care, but because these changes happen gradually, quietly, in the background. Now, here's where it becomes more grave. After 60, the risk of cardiovascular incidents such as heart attack and stroke naturally increases. That's a recognized baseline risk. But when certain medicines are layered on top of that, especially without adjustment, they can push that risk upward, sometimes subtly, sometimes significantly, and often without any clear symptoms until something happens. That's why today's topic matters, because we're not just talking about medicines, we're talking about how your body engages with them right now at this stage of life, and more importantly, what you can actually undertake about it. Now, before we go into the first 2 medicines, there's one important idea you need to keep in mind. None of what we're about to explore means you should stop any medicine on your own. That's not the objective here. The purpose is awareness, because when you understand how something works, you can ask better questions. You can have more knowledgeable conversations, and you can avoid staying on autopilot with something that may need adjustment. And this is where the first layer of risk commences, because the first two medicines we're going to discuss are among the most commonly used, especially after 60. They're often consumed daily. They're widely considered safe, and yet, under certain conditions, they can quietly increase strain on the heart and alter blood pressure in the wrong direction, or affect how blood circulates through already sensitive vessels. And once you see how that happens, you'll begin to understand why this is not just about the medicine itself. It's about timing. It's about dosage. It's about how your body has changed. And that's precisely where we're going next. Let's commence with something very common, a medicine that many individuals take without a second thought, often for years, sometimes even decades. And yet, after 60, it starts to act very differently inside the body. The first one is a class of drugs known as non-steroidal anti-inflammatory drugs, or NSAIDs. This includes medicines such as ibuprofen, naproxen, and even some prescription-strength anti-inflammatory drugs. They are widely employed for joint pain, back pain, arthritis, and everyday inflammation. And for many individuals, they feel like a simple solution. You consume one, the pain eases, and you move on with your day. But inside the body, something else is occurring. NSAIDs work by inhibiting certain enzymes involved in inflammation. That's what reduces pain. But those same enzymes also play a role in protecting your blood vessels and maintaining proper blood circulation. And this is where the concern commences. After 60, your blood vessels are already less pliable. The inner surface of your arteries becomes more sensitive to stress. When NSAIDs disrupt with that protective system, it can lead to a subtle tightening of blood vessels. That tightening increases blood pressure, and not always in a way you immediately perceive. It can be gradual, quiet, but enduring. At the same time, NSAIDs can affect how the kidneys govern fluid balance. They can cause the body to hold on to more sodium and water, and that creates additional strain on the heart. Now you have two things occurring at once: increased blood pressure and increased fluid volume. And for someone whose cardiovascular system is already laboring harder after 60, combination matters a lot. There have been multiple large-scale studies showing that long-term or frequent use of NSAIDs is linked to an increased risk of heart attack and stroke, especially in older adults or those with existing cardiovascular vulnerability factors. And this is where individuals get misled. Because the alleviation is immediate, but the impact builds slowly, you don't sense your blood pressure rising in real time. You don't perceive the added strain on your arteries day by day. But over time, it gathers. Now, here's a crucial point. This does not mean NSAIDs are detrimental. It means they need to be used with circumspection. Short-term use, occasional use, carefully monitored use may still be suitable. But daily, long-term use without reevaluation after 60, that's where the risk starts to increase. And that leads us to the second medicine, because this one is even more nuanced and even more undervalued. It's a category of drugs called proton pump inhibitors, often referred to as PPIs. These include medicines such as omeprazole, esomeprazole, and similar acid-reducing drugs. They are commonly prescribed for acid reflux, heartburn, and gastric protection, especially in individuals who take other medicines that may irritate the stomach. And on the surface, they seem benign. They reduce acid, they alleviate discomfort, they protect the stomach lining, but this is where things become less obvious. Gastric acid is not just there to cause discomfort. It plays a role in absorbing key nutrients, especially magnesium, calcium, and vitamin B12. And over time, extended use of PPIs can reduce the absorption of these nutrients. Now, that may not sound directly connected to heart attack or stroke, but it is. Magnesium plays a crucial role in heart rhythm stability. Low magnesium levels can increase the risk of irregular heart rhythms. Calcium balance affects vascular function, and vitamin B12 is involved in maintaining healthy blood vessels and nerve function. When these levels are disturbed over time, the cardiovascular system becomes more susceptible. But there's an additional layer. Some research has suggested that prolonged PPI use may affect the function of the endothelium, the inner lining of blood vessels. And that lining is essential for controlling blood flow, coagulation, and vessel relaxation. When it doesn't function properly, the risk of vascular incidents increases. Again, this doesn't happen overnight. It builds slowly, quietly, and often without distinct symptoms. Now, here is where individuals get this wrong. Many individuals are started on a PPI for a short-term issue, like acid reflux or stomach irritation, but then continue consuming it for years without reassessment. Because it feels safe, because it was prescribed, because nothing seems amiss. But the longer it persists without review, the more the underlying effects begin to matter. And this is where comprehension changes everything. Because sometimes the remedy is not stopping the medicine completely. It may be adjusting the duration, reassessing the need, or exploring whether a lower dose or alternative approach is suitable. But that only happens when the inquiry is asked. Now, what we've addressed so far is just the first layer. Two very common medicines, two mechanisms that quietly increase cardiovascular strain over time. But what comes next is where things start to go deeper, because the next two medicines don't just affect pressure or nutrient levels, they interact directly with how your heart functions, how your blood circulates, and how your system responds under stress. And once you understand that part, the picture becomes much more distinct. Now, this is where things begin to shift from subtle to something much more significant. Because the next two medicines don't just influence blood pressure or nutrient levels, they interact directly with how your cardiovascular system performs under stress. And in many cases, the effects are not instantaneous. They build slowly over months, sometimes years, which is exactly why they're so often overlooked. Let's commence with the third one, a class of medicines commonly used for sleep, anxiety, or calming the nervous system. These are recognized as benzodiazepines. Examples include diazepam, lorazepam, and similar medicines. They are efficacious. They can reduce anxiety quickly. They can help with sleep. And for many individuals, especially later in life, they feel like a necessary support. But here's what's transpiring underneath. Benzodiazepines act on the central nervous system. They slow brain activity, which creates that calming effect. But they also slow down other systems in the body, including respiration, reaction time, and coordination. Now, you might ponder, how does that connect to heart attack or stroke risk? This is where the mechanism becomes significant. As we age, the body becomes more sensitive to these medicines. They persist in the system longer, they accumulate more easily, and their sedative effect becomes stronger even at the same dose. Over time, this can lead to reduced physical activity, less movement, and more time spent sitting or lying down. And that matters more than most individuals realize, because circulation depends on motion. When movement decreases, blood flow becomes less effective. The risk of clot development increases, and oxygen delivery to tissues becomes less optimal. But there's an additional layer. Benzodiazepines can also affect respiratory patterns during sleep. They can contribute to shallow breathing or worsen existing sleep-related breathing issues such as sleep apnea. And when oxygen levels drop repeatedly during the night, even slightly, it puts additional strain on the heart. Now you've got a combination: reduced circulation, lower oxygen levels, and increased susceptibility in an aging cardiovascular system. And again, this doesn't feel dramatic. It feels like tiredness. It feels like slower mornings. It feels like normal aging. But underneath, the system is under more stress than it should be. And this is where the long-term effect starts to matter, because over time, these small changes can contribute to a higher risk of cardiovascular incidents, especially when combined with other factors such as high blood pressure or existing vascular disease. Now, here's something most individuals don't realize. The risk is not just from consuming the medicine. It's from ingesting it continuously without reassessment as the body changes. And that leads us to the fourth medicine, because this is where things become even more intricate. Not because of what the substance does on its own, but because of how it interacts with everything else. The fourth category is certain decongestants and stimulant-like medicines. This includes drugs containing pseudoephedrine and some combination cold remedies. These are often used for sinus congestion, colds, or seasonal discomfort. And they are readily available. Many are available over the counter, which makes them feel harmless. But their mechanism is very different. Decongestants work by narrowing blood vessels. That's how they reduce swelling in the nasal passages. But that effect does not stay confined to the nose. It affects blood vessels throughout the body, including those linked to the heart. When blood vessels narrow, blood pressure rises, heart rate can increase, and the heart has to work harder to push blood through a tighter system. Now, in a younger body with pliable arteries, this effect is usually tolerated. But after 60, when arteries are already less resilient, that added constriction can become significant, especially if someone already has high blood pressure or is taking medicines that affect cardiovascular function. And this is where combinations become dangerous, because many individuals do not take just one medicine, they take several. A blood pressure medicine, a pain reliever, something for sleep, and then, during a cold or allergy season, a decongestant is added on top. Individually, each one may seem manageable, but together they start to interact. One raises blood pressure, another affects fluid balance, another slows the system down, and the body has to compensate. Now, here's where individuals get caught off guard, because the trigger event, the moment something happens, often seems abrupt, but the buildup has been there for an extended time. This is what makes these situations so deceptive. It feels like it came out of nowhere, but in reality, it was a gradual buildup of stress on the cardiovascular system. And this is why comprehension matters more than anything else, because when you understand how these medicines interact, you start to see patterns. You start to recognize when something may not be working in your advantage anymore. And that's where the next part becomes crucial, because there is one more medicine. And this one distinguishes itself not because it is rare, but because it is incredibly common, widely used, and almost never questioned. And once you understand how it affects the body after 60, it changes the way you look at it completely. Now, this is the one that tends to surprise individuals the most, not because it's obscure, not because it's rarely used, but because it's everywhere, consumed daily, trusted, and often assumed to be completely harmless. And yet, after 60, the way it interacts with your body can quietly shift in a direction that increases cardiovascular risk, especially when it's employed without regular review. The fifth medicine is low-dose aspirin. For years, aspirin was widely advised as a simple way to protect the heart. A small daily dose, often called baby aspirin, was thought to help prevent heart attacks and strokes by reducing blood clot formation. And in certain scenarios, that is still true. For individuals who have already had a heart attack or a stroke, or who have specific high-risk conditions, aspirin can play an important protective role. But here's where things transformed. More recent research has shown that for many adults over 60 who have not had a previous cardiovascular incident, the routine use of aspirin may not provide the benefit people once believed. And in some instances, it may actually increase risk. Now let's analyze why. Aspirin works by reducing the ability of platelets to adhere. That helps prevent clots from developing inside arteries. But clotting is not just something detrimental. It is also a protective mechanism. Your body uses it to stop bleeding when vessels are harmed. After 60, blood vessels become more brittle. The lining of the digestive tract becomes more sensitive, and the balance between clotting and bleeding becomes more fragile. So when aspirin reduces clotting ability in this context, it can increase the risk of internal bleeding, especially in the stomach or brain. Now, you might ponder, how does that connect to stroke or heart risk? This is where the nuance is significant. There are two main types of stroke, one caused by a clot blocking blood flow, and another caused by bleeding in the brain. Aspirin can reduce the risk of clot-related strokes, but it can increase the risk of bleeding-related strokes. And after 60, especially without a clear cardiovascular history, that balance can alter. In some individuals, the bleeding risk starts to outweigh the protective benefit. And that's precisely what more recent clinical guidelines have started to reflect. Now, here is where this becomes even more significant. Many individuals started consuming aspirin years ago based on older recommendations and simply continued. No change, no reassessment, because it felt like a safe preventive custom. But medicine evolves, and what was once standard practice is not always the best approach today. This does not mean aspirin is detrimental. It means it is precise. It must be aligned to the right situation, the right risk profile, the right individual. And this is where comprehending your own context becomes crucial, because consuming aspirin just in case, without knowing whether it truly benefits you, can create a situation where risk is added without meaningful protection. Now, here is the alteration that matters. Up to this point, we've discussed 5 medicines, each with a different mechanism, each affecting the body in a different way, but they all possess something in common. Their risk increases when they are consumed the same way, despite the body changing over time. And this is where control reverts to you. Because the most important step is not stopping everything. It's comprehending what needs to be reevaluated. So here are a few practical things that actually make a difference. First, review your medicines regularly. Not just when something goes wrong, but proactively. Ask your doctor or pharmacist, do I still need this at the same dose? Has my risk profile altered? Is there a safer alternative at my current age? Second, pay heed to combinations. Many of the risks we talked about are not from a single medicine, but from how multiple drugs interact. Even over-the-counter medicines, even occasional use, everything counts. Third, watch for subtle indicators, not dramatic symptoms, but small alterations. Increased tiredness, shortness of breath, unusual dizziness, changes in blood pressure readings. These are often early indicators that something needs adjustment. And finally, comprehend that your body is not static. What worked 10 years ago may not be ideal today. And that's not an issue. It's simply part of how the body develops. Now, what we've addressed so far gives you a clear picture of where the risks can come from. But the most important part is still ahead, because comprehending the problem is only one side of it. What truly matters is what you do with that information moving forward, and how you use it to protect your health in a way that is practical, realistic, and grounded in how your body actually works today. If there's one thing to take away from everything we've just addressed, it's this. The real risk is not the medicine itself. It's consuming it the same way while your body is no longer the same. Because after 60, your body is not simply an older version of what it used to be. It operates differently. It processes compounds differently. It responds differently under stress. And most importantly, it tolerates disequilibrium less easily. That means even small mismatches, small excesses, and small interactions can have a larger consequence than they once did. And this is where many individuals unknowingly fall into a pattern. They continue what has always worked. They trust what has always been ordered. They follow the same routine day after day, year after year, not realizing that the context has altered. And this is not about doing something wrong. It's about something that was never clearly elucidated. Because in healthcare, there is a concept that doesn't get talked about enough. Not everything needs to be introduced. Sometimes things need to be adjusted, reduced, or reevaluated. And that process is just as important as starting a treatment in the first place. Now, here's where this becomes empowering rather than disquieting, because once you understand this principle, you begin to see your health differently. You stop looking at medicines as fixed, permanent solutions, and you begin to see them as tools that need to be employed at the right time, in the right way, for the right stage of life. And when that alignment is correct, they can be incredibly beneficial. But when that alignment drifts even slightly, that's where risk starts to build. Now think about the 5 medicines we explored. Pain relievers, such as NSAIDs, helpful for reducing inflammation, but capable of increasing blood pressure and fluid retention when used long term. Acid-reducing drugs, such as proton pump inhibitors, useful for protecting the stomach, but capable of affecting nutrient balance and vascular function over time. Benzodiazepines, calming the nervous system, but potentially reducing movement, altering respiration, and affecting circulation. Decongestants, clearing the sinuses but tightening blood vessels and raising cardiovascular strain. And aspirin, protecting against clot development in the right context, but increasing bleeding risk when used without clear indication. Each one has a purpose, each one has value, but each one also has a threshold, a point where the balance can alter. And that point is not constant. It moves with age, it moves with changes in your body, it moves with other medicines, with lifestyle, and with underlying conditions. And that's why comprehension matters more than anything else, because awareness leads to better questions, and better questions lead to more optimal decisions. Now, here's something simple, but incredibly powerful. At your next medical appointment, instead of only focusing on new symptoms or new prescriptions, inquire about this. Is everything I'm currently consuming still appropriate for me at this stage? That one question changes the conversation. It shifts the focus from adding to evaluating, from reacting to optimizing. And often it opens the door to adjustments that reduce risk without removing necessary assistance. Because again, the goal is not to remove everything, it's to make sure everything you're consuming is still working in your favor. Now, another important point, your body gives indicators, not always loud ones, but consistent ones. And learning to discern them can make a real difference. Subtle increases in tiredness, a sense that your energy drops faster than it used to, lightheadedness when standing, shortness of breath during activities that once felt easy, changes in sleep quality. These are not always dramatic, but they are meaningful. They are often the early signs that something in the system needs attention. And when you combine that comprehension with regular review, you create a level of control that most individuals never develop. Now, here's where everything converges. The difference between reacting to a heart attack or stroke and preventing one often comes down to small adjustments made early. Not one big change, not one dramatic intervention, but a series of small informed decisions that keep your system balanced over time. And this is where you have more sway than you might think. Because while you may not control every risk factor, you do have control over comprehension. You do have control over asking questions, and you do have control over making sure your current routine still aligns with your current body. That's what makes the difference. Not fear, not avoidance, but congruence. Now, if this helped clarify something for you or made you look at your routine a little differently, consider staying connected to the platform, because this is exactly what we do. Focus on here. Not quick fixes, not exaggerated claims, but clear, practical understanding of how the body actually works and what truly makes a difference over time. And if you know someone who is taking medicines daily, especially after 60, sharing this with them could make a real impact, because sometimes the most important changes start with a simple realization that what worked before may need to be looked at again. And once you see that, you begin making decisions in a completely different way. Title: After 60, these 5 medicines increase the risk of heart attack and stroke.